Good morning, guys. Happy Friday to you all. Got a little helper with me today to talk to you a little bit about ACL ruptures. So I just woken up to the news this morning that had another AFL player, in this case with the men's side of things, Harrison Wiggs, so a young player on the Gold Coast list, ruptured his ACL in a practice match training this week, which is off the back of Shay Sloan. So the sister of one of my favourites, Rory Sloan, having done hers in her debut a couple of weeks ago. So what we find with particularly the professional athletes, and especially when it comes to AFL, there is an absolute, as far as the intervention, is surgery. Reason being, it's we have very limited career spans, too much riding on it for the club, the player and the medico to sort of veer away from something that may be a bit unpredictable. Hence why we'll always see the surgical intervention. But a lot of the times, particularly more recently, is giving it a little bit more time between the actual injury itself and going in to surgery. So letting things sort of calm down before going straight into surgery. So Tyson Goldsack from Collingwood, he was a really good example of that, probably about this time last year. So he did his in February, I believe, and had about 6 or so weeks of dedicated strength training to really lay down some foundations, get his range of motion back, build up some strength before going in, and that led to him actually getting back in time at the end of the season. So when it comes to other people, so whether it be the lower level amateur sports or just those unfortunate people who have maybe filled in for their mates indoor soccer or basketball or something like that, and have no real ambition or intention of returning to any particular sport, there is a lot more evidence sort of emerging that going non-operative is absolutely a realistic alternative. So a really long-term study, a 20-year study, found that those who went non-operative had no further increase in developing knee osteoarthritis. So that was obviously a concern of some people. Well, when they do rupture their ACL, they think, do I need to go in for surgery for just the long-term health of my knee? Where good news is we're finding that with the conservative management of going through non-operative long-term, just as a healthy knee as going through the surgical route. But regardless of the intervention, whether you go surgical or non-surgical, the key thing is really sticking to your rehabilitation. So your dedicated strength and balance and what's called proprioceptive training. So really retraining the brain and body, regaining that connection, so you don't have those instances of losing balance and having the knee cave inwards or hyperextend, is absolutely essential. So regardless, having that tailored, progressive, dedicated 6 months minimum, so really ideally going beyond that, but at least 6 months to really give yourself the best chance of avoiding re-injury or just getting back to what you need to be doing, enjoying your life, doing your hobbies, things that you love. So that's why, the Injury Rehab Centre, we love our facility. We love what we do on our site, having the strength equipment, having the technology to be able to see where you are at baseline, whether that's after injury or whether that's after surgery, and really being able to track your progress there using the latest technology, using the mat, which is, as we mentioned the other day, crucial for going through your HOP series to making sure you're ticking all the right criteria before going back to sport. So see what this one thinks. What do you reckon? Brule? So this is Brule. She's a 2-year-old cavoodle, and she feels very strongly about doing your rehabilitation as well. So she's a strong candidate for that, aren't you, Brule? So basically, it all comes down to depending on what your goals are and where you want to get to. Can be either or. The key thing is rehabilitation, dedicated minimum 6 months to get the best results. Enjoy your Friday, guys. Have a great weekend.